I'm Dr. Gary Cowell of Mobile Physical Therapy, and I just released the 5 signs that you're a runner with a problem that can easily be fixed with physical therapy checklist. Each week, we'll review each of the signs in greater detail. So who is this for? This is for runners, whether you're a competitive, novice, or recreational runner. I've seen patients who are high-level triathletes. I've seen mothers, I've seen fathers and parents who enjoy staying active and fit, as well as those who may have been injured and want to return back to running. So sign number 1 that you're a runner with a problem that can easily be fixed with physical therapy is that you have pain at rest or you have pain with day-to-day activities. Having pain with daily activities, especially those that are lower intensity than running, is a red flag that an injury might be brewing. You may have issues that change your running form that you're not even aware of. And this can lead to injury and more time away from training and friends and socialization. So here are the things that we do to help you keep running, run faster, and return to running from injury. We address mobility and tissue tightness issues, whether it's muscle, fascia, or neural tightness. There are a number of techniques that we could use, such as contract, relax, neurorespective stretching, strain, counter strain, just to name a few. So why is having mobility and flexibility so important? Well, it's important because the body is a lever system. And in order for your system to work most efficiently, the muscles must have the length necessary to place the joints in the best position, so that they can have the most mechanical advantage, and mobility and flexibility are huge components of that. And when the joints are in the proper position, the muscles are much better at producing the force, and at the same time, they decrease the stress on the joints while you run. We strengthen the weak musculature, particularly the muscles surrounding the pain. So let's face it, if you have pain, you're gonna have some weakness. One of the ways that we help reduce the stress on the painful region is by strengthening the muscles surrounding and supporting the painful region. This helps take the stress away from the painful tissue and allows your pain to calm down. Once your pain calms down, then you can be progressed into our running readiness program and get you back to the running that you enjoy. I assume, like most people, you probably search the internet to find the ways to strengthen your muscles, or you got some exercises from your personal trainer, or if you're lucky, you got to sit down with a doctor. But searching the internet and getting exercises from your personal trainer has its own risks. So sometimes you get the wrong exercise at the wrong time, which can result in further injury. Or sometimes you may even have the right exercise, just the wrong parameters. Maybe the intensity is set at too high, or maybe too low. I actually had a patient who purchased a 5-treatment package from me, and she was diagnosed with the dreaded L4, L5 herniated disc. She would travel over an hour to be treated, and after about 3 times, she's making great progress. Her sitting tolerance has improved. She no longer had increased pain while walking. And just to make a long story short, she went to a personal trainer and tried some new exercise with the personal trainer, which resulted in a full-blown return in her symptoms. She had pain from steering down the back of her leg all the way to her foot, and she had it constantly throughout the day. As a result, she had to go to the doctor. The doctor placed her on a steroid pack to help decrease the inflammation, and luckily we'll be resuming care in about a week's time. But to re-experience the time, imagine re-experiencing that pain again and losing time away from your recovery. Maybe you got to sit down with a doctor, but let's be honest, you probably spent more time searching for exercises on the internet than you had to sit down with a doctor. And spending so little time with the doctor, can you really get the best exercises? We take pride in prescribing the best corrective exercises with the correct parameters tailored specifically to reach your goals within your particular lifestyle. We also perform runner readiness and running gait assessments. The runner readiness assessment is comprised of a fitness and injury review, where we review your past injuries and see how they incorporate. A runner movement screen, where we look at your mobility and your movement patterns, so you'll know which mobility limitations are associated with your injury or your issue. A runner's motor control screen will assess your strength and muscle coordination of the key muscles that are associated with running and running issues. You'll also get a doctor's report of findings. And during the gait assessment, we'll look for your foot inclination angle, your tibial inclination angle, your knee flexion at initial contact and mid-stance, your hip separation angle, as well as frontal and posterior views of your running. The gait analysis will place you in a running fault category if you present with one. You will then be provided with the corrective exercises, the drills, and the cues to abolish your pain, but also at the same time improve your running form. And lastly, we look at other factors that could be contributing to your running pain as well. For example, let's say you work in front of a computer and all day you're sitting there, your back is irritated while sitting. Then you find that your run is also limited by back pain or some other pain. We search to find the connections between your daily activities and your issues that you have with running. We also take pride in incorporating the recovery into your lifestyle. So let's say you have like 2 or 3 kids, we'd figure out how to incorporate your exercises or your recovery program into your childcare. So that way, when you're caring for your children, you're also getting the exercise necessary so that you don't take time away from the things that you need to do, so that you can do the things that you want to do. So to summarize, we reviewed the first sign that you're a runner with a problem that can easily be fixed with physical therapy, which is you have pain at rest or with day-to-day activities. We also went over 5 ways that you can easily fix your running problems, which are addressing your mobility limitations, your muscular weakness, and your daily activities contributing to your running problems. We also provide a runner readiness assessment and a running gait assessment. And lastly, we incorporate your exercise and recovery program into your lifestyle so that you can do the things you need to do, so that you can do the things that you want to do. So now, in the next video, we'll be going over sign number 2, that you're a runner with a problem that can easily be fixed with physical therapy. We'll also review 5 common injuries that are often seen in runners. And if you're struggling with any of these issues, or struggling and want to return to running, we're doing something special for New York City Yorkville runners. We're offering a runner readiness assessment for only $47. You're getting a fitness and running injury review, a runner's movement screen, a runner's motor control screen, and a doctor's report of findings. And that's over a $250 value for $47, but there are only 11 spots left. So if you have these issues and you would like to return to running or learn more, just drop a run in the comments below, or you can click on the link in the comments and a running specialist will reach out to you. We'll see you next week, and be well.